Obsessive compulsive disorder, OCD, is one of the very common psychiatric disorders I end up treating every day. What happens in OCD? In OCD, you have repetitive thoughts which come to your mind over and over again. Sometimes you know them to be absurd and illogical, but they keep on coming back and you have no control over them. But the more important thing is that they're coupled with anxiety. Each time the thought comes, it brings back with it anxiety. Each time anxiety comes in, it brings back with it the thought. It could be one thought, it could be many thoughts, it could be doubts, fears. Let me give you some examples of obsessions. For example, somebody might have a doubt that their hands are not clean, and they might end up cleaning their hands over and over again to ensure that their hands become clean. But each time they clean their hands or wash their hands, they might still feel that it's not clean and might go and wash themselves again. This repetitive thought that my hands are not clean, because it's linked with anxiety, is obsessive. All of us sometimes have had this thought that our hands are not clean. Sometimes we've also had the doubt that we've not cleaned them enough. But what's the difference between an obsessive thought and a thought that all of us have is that the obsessive thought is repetitive, intrusive, takes over life, and is anxiety provoking, and one needs to do something about it to address the thought. We cannot just sit idle just having the thought, and that's why it's an illness. The second part, washing the hands over and over again, is the compulsion. It's what we do to neutralize the anxiety generated by the thought. Now, the commonest form is, of course, the contamination part, but there are many other forms of OCD. The content of OCD can be very varied. For example, you're reading a book, you feel that you've not read well, you start reading the paragraph again, to the extent that you never finish the page because you keep on going back to the beginning of the paragraph. You could be hoarding things, thinking that you might need them later. You might feel a slightly different form of obsession, that you might feel that the shape of your nose is not good enough. This is called dysmorphophobia. Sometimes the compulsions are not behaviors, not actions that we take. Sometimes our compulsions are our thoughts. One of the commonest compulsions which I see is reassurance seeking. Have I done this rightly? Is this all right? When one is indecisive, checking over and over again from somebody else whether it's been done right or not. Again, we all do it, but when it becomes intrusive and takes over our life, it becomes a compulsion. These are called neutralizing thoughts, and one of the commoner ways of doing a compulsion, it's not always washing hands that is a compulsion in OCD, and that's why I want to broaden the definition. OCD is very common. Some studies say it's as common as 3% of a population. Some studies say it's less common, about 2% of a population. But 3% in India, can you think of the numbers that we're talking about? 95% people do not get to seek help because they're too far away from help. But if you're being distressed by thoughts which are coming to you over and over again, and if you are spending a lot of time on these thoughts, and OCD could start early, sometimes as early as 6 or 7 years of age, and sometimes people might not seek help till about 20 years of age, till the distress has become so wide and they've almost stopped in their life. There's inertia and stagnation in their life because of OCD. Don't let it hang till that time. Read up about it. Obsessive compulsive disorder is one of the most commonly quoted diagnosis on the internet. Do read up about it. There's a book that I can recommend called Brain Lock. It's written by Dr. Schwartz. Describes easy ways of identifying OCD and also helping yourself.